It was perhaps the centerpiece of President Obama's speech last night, a call to freeze domestic spending for 5 years. Obama says that will save $400 billion, and Republicans say it's not enough. For more on the freeze and what it means specifically for health care, we turn now to Donna Shalala. She was the Health and Human Services Secretary under President Clinton, the longest-serving secretary in that role, and she is now the president of the University of Miami. Madam Secretary, thanks so much for joining us this morning. Glad to have you on the Inside Track. What did you make as far as President Obama's comments went last night that health care reform is part of this deficit reduction bill? We haven't heard this language from him in a while.
Exactly. He's really making the point that if we can get health care reform, the CBO, the Congressional Budget Office, bipartisan, has said over and over again that it will help reduce the deficit, that the growth of health care is literally taking out all sorts of other things that we want to do. It's driving businesses crazy because they don't know exactly what their health care costs are going to be. It's very much a private sector issue. It's not just the public sector and the expansion of coverage. Anything we can do to bend the curve in terms of the growth of health care costs will help in the long term to give us a healthier economy.
Madam Secretary,
I thought he made that point very clear.
To what extent was that a strategic language, meaning that we've seen so much resistance still from the Republican Party as to his health care plan, health care reform, including it in the State of the Union, I assume, was meant to push things forward for the Dems?
It was very strategic because he reminded them that this was not about the expansion of government. This was also very much about reducing health care costs in the long run. And that was one of the goals of health care reform. So in many ways, he was warning them that if you don't do this, health care costs, government health care costs, private sector health care costs are going to continue to be out of control.
We know that he gave a slight nod to the Republicans as well, and he spoke about medical malpractice and this possibility of liability reform. We know you are in Florida, a very litigious state. How did you read his comments and the fact that he did give a nod to Republicans on this point?
I thought that was very important. This issue has been left to the states for the most part. The idea that the federal government would now get involved and recognize a relationship between malpractice and the overuse of the healthcare overuse in the healthcare system, I think is a very important statement. How to do that? There is some money in the health reform bill for states to experiment with different kinds of approaches, particularly moving these issues out of the courts into a fairer administrative structure. I very much favor that. I don't think it's a Republican or a Democratic issue, but the Republicans have taken the leadership on this, and I, for one, appreciated the fact that the president brought it up because it certainly is a place where we should be able to find common ground.
Madam Secretary, thanks so much for joining us with your reaction to the President's State of the Union address. We are joined there by Donna Shalala. She is the president of the University of Miami, and she was the longest-serving Secretary of Health and Human Services under President Clinton.